All right. Well, welcome everyone. It's another fantastic morning here at Healthline Markets. Thank you all for being on this call live and in person. We really appreciate your time and attention as we continue to move these meetings forward. It is September 30th, 2024, 9 o'clock, and I hope everyone knows what tomorrow is. Tomorrow is the beginning of the 2025 season. And we're going to go through the rules of the road there this morning, but this is the last chance of regular time as you guys get super busy for this year, and super proud of all the work that everyone put in preparing for AEP this season, and we're so excited to see your success. So with that, remember that we have one simple mission, and that is to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. Now, as we move these calls forward, remember that we are recording these calls and they are hosted on YouTube. So clients come first, always and forever. So if somebody needs to meet you on a Monday morning and it's at 9 o'clock, go do it. These calls are recorded. We'll usually go ahead and have the calls posted by Wednesday of every week. So you might miss a couple of days, but it's okay. We're going to make sure that you get those updates. And then we also have some updates on HQ, which we'll share with you as well. So with that, we still, throughout AEP, will have a minimum amount of training, but we still want to make sure that you guys are aware that there are training sessions that are happening across the companies and then also here with HPM. So with that, I do want to share my screen and we'll go from there. So go here. All right, so as you know, we've got to keep one foot in the classroom and the other one in the field. Today, you've got some rollouts from Aetna over in Merritt Island, and then United Healthcare is doing a dental vision hearing training at 1 o'clock today. Now, there's quite a few trainings, but the ones that I marked in purple are ones that I would highly recommend that you pay attention to as we move forward. So tomorrow at 12, United Healthcare is doing a chronic condition special needs plan. And it's amazing to me how many people are out there that qualify for a CSNP plan, and the agent that got them enrolled in the plan that they're currently in put them on the wrong plan and they qualify for a CSNP. So if you're bumping into people like that, you know, if you're not familiar with chronic conditions and how to spot them using the medications, then this might be a really great training for you to improve your sales skills and also make sure that your clients are on the right plan for the right reasons. So check that one out. We still have quite a few rollouts that are still happening, but there's some other trainings as well. Don't forget that our contracting team is always available for questions and answers every Wednesday at 11. So if you have any issues, you can jump on the call with Sam and Jess. But also on Wednesday, the United Healthcare is hosting a Part D 2025 update. There has been a significant changes in Part D. So if you did not pay attention to AHEP, this is going to be a great training for you to ensure that you are giving the right information for your clients on the new Part D program. So it's completely changed, and if you're not familiar with it, please make sure that you jump into that call. Moving over to Thursday, we also have our own HQ intro training. If you do not have HQ from HPM, this is our portal system for you. Please jump in the call Thursday at 3, and Gabe and team will make sure that you're up to speed on that. We're going to talk about HQ this morning as well. Friday, we have updates on the 2025 HPM shop. We're going through, our partner with Connecture will be on the call to roll in, basically roll out our 2025 HPM shop, and that's at 11 o'clock on Friday. It will be live tomorrow with the new plans. The URL is not changing, so it's the same URL that you always log into, and you will start to see the 2025 Medicare plans tomorrow. You will not be able to do enrollments. That's on purpose. Please remember, you cannot enroll anybody until the 15th of October. But however, you can do everything except the enrollment. You can pitch the plan, you can show quotes, you can go through benefits, but you just can't do the enrollment or accept applications. So Any questions on that, please reach out to us. But remember, all the training is located in HQ. You go over to Learning on the left-hand side, drop down, and you will see HPM training. So we click that, and the training calendar lives here. All right. So you're able to see exactly what's going on for the week. And so all of those things that I just mentioned will be there. So you can click on that, you can register, and off you go. So a lot easier to use and get the info that you need. Now, we're in HQ. If you haven't been in here in a while, I want to continue to let you know that we are launching updates. We have decided to minimize our emails to you because you're getting so many of them, and many of you are not even reading your emails. So we've decided to post important updates here on HQ. So all you got to do is log in on the front page. You'll have the most recent 5 updates that we have posted here. I am posting another update in just a few minutes that you'll see. But here you'll see all of the updates. So for instance, here's the update about Devoted Health reducing their service area. And when you click this, that has the blog that I wrote about what's happening with Devoted. Okay, so those things that I'm seeing in emails that are most important will live right on the front page here. So want to make sure you're aware of that. Also, some great updates. I want to point out our contracting department. When you click down, if you're going over to all carriers, we have added quite a few new products that I want to point out. But Fernando has done a fantastic job at reorganizing our portfolio here. And we've made it very easy right now, and this is going to improve. But for now, if you are wanting to add one of these carriers, just email contracting@askhpm.com. It's even got a search here. So if you're looking for Florida Blue and you click search, let's just say Florida, there it is. You got Florida Blue and Florida healthcare plans available right there. You can search for it to make sure that we've got that contract. But if you are looking through our portfolio and you're like, hey, wait a minute, I don't have Florida Blue, I want to add it, just shoot us over an email to contracting@askhpm.com. Some of these carriers may not be in the areas that you service. For instance, Highmark is in the northeast corridor of the United States, so not here in Florida. However, we do have that contract for those folks that are selling in that area. And then one thing that you'll notice on the bottom is there's a See More button that I want to make sure that everybody clicks that, and you'll be able to see a couple more. So we've added WellPoint on the ACA side. That is a new contract, and Solis Health Plans is also a new contract. As well as Sonder, if you're in the Georgia market, we've added Sonder as well. So if you are looking to add any of these contracts, very simply just email contracting@askhpm.com so you have that, okay? Also want to go down to resources here, and we are building out an AEP survival kit. It is in the works. We're continuing to work on that, but you can check back on some cool stuff that we're going to have available for you in there. And then, as always, I want to point out Benefits Checkup as a phenomenal tool to help your clients apply for extra help. This is very, very simple to do. It is run by the National Council on Aging. It is an agnostic site, meaning that it's not owned by any carrier or anything like that. However, there are some carriers that sponsor this particular website, but they have nothing to do with it. So you can apply for a Medicaid, LIS, food assistance, utility assistance, even rent and mortgage assistance. So you coming in as a hero, basically letting people know that you can help them above and beyond just getting them a health plan, really adds significant value on what you do every day. So I just wanted to point that out as well. All right, so I do want to talk to you about State of the Union here as we're moving forward and going into AEP 2025. As I mentioned before, tomorrow you can begin talking about benefits with your clients for 2025. You can show them the plans, you can do scope of appointments, permission to contact, you could have started your scope earlier this week, which is fine because now scopes are good for a year. Okay. Now, once you have that meeting, even if they don't buy anything, that scope is burnt, and you got to do a new scope of appointment for every meeting or every virtual call that you do regarding benefits. Okay. So if you did a scope in June and they decided, you met and you used that scope of appointment for that appointment scope is used. You've got to redo another scope. So tomorrow you should have a brand new scope of appointment for your clients, and you can begin talking about 2025 benefits. Again, you can meet with them, you can talk about benefits, you can compare on HPM Shop, you can send quotes. The only thing you cannot do is take an application. You won't be able to do it on HPM Shop anyway, but I just want to make sure that you're aware of that. Now, as far as strategy goes, for those of you that are doing in-home appointments, you can even help them fill out the application, but you have to leave it with them, okay? So if you're out there, one of the strategies is go out there, help them find the plan. If you know what plan they're going to be on, as much as that sucks, do the paper applications now and then fill them out. And then on October 15th, you're going to drive back around and pick up all those applications and get them signed. That's the most efficient way to use pre-AEP, which is a time period that we're in from tomorrow until October 14th. That's just one strategy that you can do. If not, you can go ahead and take all the notes that you want, and on October 15th, all you're doing is just crushing applications and getting them filled out. That's totally another strategy if you want to save your gas money, which is something that I'd probably do as well. So again, we're going to have training on Friday. I mentioned that earlier in the call, but for those of you that do need some TLC on HPM Shop, just send us a note, support@askhpm.com, or you can even chat with us in HQ. On the bottom right corner, we've got a chat feature. From what I've seen, you can actually leave us a voicemail, which is really cool, without having to pick up your phone. Okay, so if you're on your computer, you just turn on your mic and you can leave us a note there. One thing I'd like to ask too is when you're in HQ, if you do have feedback, please leave it on the top right corner. There's a feedback button there. We can't make this thing better unless we get your feedback. So it's really important that you let us know what we can do to improve it and what you're really looking for as an agent to get that done. So really, really important as far as how that goes. Okay. All right. Also, I do want to mention a couple of things that are going on that if you haven't noticed, your clients are now getting the ANOC letters and books in their mailbox. What is an ANOC? An ANOC is your annual notification of changes, ANOC, ANOC. Your ANOC is your annual notification of changes, and your members are getting these, and basically it's what's changing in their plan for 2025. Some companies do a better job of highlighting what's changing and others do not. So it's your job to inform your clients of any pitfalls in their plan that's coming up and making sure that they're put on the right plan for the right reason. Okay, so your members should already start calling you if they haven't already. ANOC should be in mailboxes by today. That is a CMS regulation. So all of these carriers, you'll probably start seeing quite a bit of phone calls coming in because people are getting their ANOC letters and notifications. Okay. Couple other updates. United Healthcare has notified everybody that Lean, their e-app, is no longer available. It's gone, and now you have to do it through their portal system. Okay. And this is another reason why you should consider using HPM Shop if you're not already using it. Having to learn another software at this point, I don't know why you would want to do that as an agent. We have invested in a cutting edge, a bleeding edge enrollment software system that's only improving for 2025 to make your life easier. We've got some really cool features that are adding into it, but I want to make you aware that the Lean e-app system is gone. It's not going to work. And so rather than learning their new system, why don't you just invest in HPM Shop? It should be a thing for you. Okay. Lastly, I just want to point out that Humana's HRA form I was told that the link was broken or it wasn't working. Please keep in mind that in HPM Shop, the carrier has the choice to bake in their HRA, meaning that it's one seamless application inside HPM Shop, or they have the option of bouncing you out into their own HRA portal system or platform that they're using. And so if you see that and it's bouncing you out, that is normal. If it's not working, please send us an email to support@askhpm.com and we can look into it. The HRAs specifically are going to be available for most carriers. Not every carrier is going to pay for HRAs for every plan, so please keep that in mind. We'll continue to build out a resource so you know which carriers are paying for which HRAs. So super important, just some extra dollars that you can put in your pocket for literally helping your members get a little bit more healthy. So with that, we should have a special guest on the line. Do I have Heidi from Florida Blue? Is she hiding somewhere?
Good morning. Yes, I am here. Can you hear me?
There she is. How are you, Heidi?
Everything good. Thank you for having me this morning. I appreciate it. So thank you to you, Justin, and the HPA team.
Absolutely, absolutely. So I know you have quite a few updates on Florida Blue. There's good news, bad news, ugly news, and rumors, and we brought Heidi on to dispel all of that and give us the source of truth. So Heidi, if you can introduce yourself and then take it away.
Definitely. So good morning again. My name is Heidi Sierra. I'm your broker manager for both Florida Blue Medicare and FHCP Medicare. So yes, there's some rumors going around. I know the last time that I saw you all was August 22nd at Andretti that we had the training. Like Justin mentioned, there has been so many updates. It's incredible how much happens in a month. But I want to tell you that most of the updates that I have are actually all of the updates are very, very good for you. So just as a refresher, in case that you were not aware, Florida Blue Medicare is exiting the DSNP space, so we're not going to be offering DSNP products for next year. So I think that was the biggest shocker for the market for us, that we're not offering DSNP. The other one that actually was kind of like a blow for the Orlando area was that, in case that you didn't hear, we're also losing the value PPO in 3 counties, Orange, Osceola, and Seminole in the central area. But I also wanted to tell you that in case that you were not aware, you can sell both plans, Florida Healthcare Plans and Florida Blue, as long as you're ready to sell for Florida Blue. Even if you skip the training for FHCP on the certification, which I get that question all the time, Heidi, I skipped it. It doesn't matter if you skipped it. You're still ready to sell for FHCP. They operate in Seminole, Brevard, Volusia, Flagler, and St. Johns counties. And FYI, today, like this morning at 10 o'clock, we're having an FHCP training with FHCP leadership answering all your questions, and it's live. So at 10 o'clock, you should have received the invitation at least 2-3 times last week. The last time it was sent, it was Friday. So please look at your inbox because that invitation should be there for today at 10 o'clock. Other updates that I want to give you is that we still have the Premier HMO in Orange and Osceola. We don't have it in Seminole for next year, but we still have it for Orange and Osceola. Very low MOOP, 0 on the primary. And remember that we offer an SBCI package, meaning that even though the Premier HMO is not a CSNP, this is the core HMO, but it will still give our members with chronic conditions 20 meals per month or a $50 food card allowance every month, depending on the county. Another update that I did not have at the time in August is that starting next year, 1/1/25, all Premier HMOs in the state will offer OTC retail. That is a big deal. We've never done that before. So again, OTC retail only for the Premier HMO statewide. So they can start going to Walmart, CVS, Walgreens, and Publix and grabbing their OTC items from the shelves. Another thing that you need to remember is that none of the HMOs at Florida Blue will have a deductible on medication. I've already seen, I'm sure like you have seen too, plenty of carriers adding very high deductibles on the medication part of these Medicare Advantage, and I'm proud to say that at least at Florida Blue, we have no deductible at all in any HMOs on the medication. On top of that, most of our premier HMOs do have zero copays on the first 2 tiers. And I do want to dispel another rumor that I've been hearing. Oh, Heidi, are you losing Orlando Health? Are you losing the specialists? No, we're not. No, we're not. So I want you to know that we still have the specialist network for Advent Health, Orlando Health, UF, HCA Healthcare, TVH, which is the Villages Health, and Moffitt Cancer Centers. And all these participate for our PPOs, of course, but also for our HMO. So no need to panic. What we did with Orlando Health, we just termed the primary care group. And as we move forward with these regulations, you're going to see that a lot of the primary care groups affiliated with the hospital will be affected by this. And again, it was only the primary care group. You still have the specialist network for all these groups, and we still have the facilities. Having said that, moving on to the value PPO, yes, I addressed that we don't have it in Orange, Osceola, and Seminole for next year, but I want you to know that all the surrounding counties do have it. So Volusia, Brevard, Polk, Lake, Marion, Sumter, all the surrounding counties in Orlando do have the value PPO. And remember, it's zero premium, zero primary copay. You have in-network doctors for 49 states, including Puerto Rico and Hawaii. Remember that Florida Blue owns Triple S Network in Puerto Rico, which is very, very popular among Puerto Ricans in Central Florida. And our value PPO still has a low deductible. Medications, $150 to $175, depending on the area, which is still pretty good. MedSups, this is good. Please listen to this. If you were not aware, because I'm still finding people that are not aware, MedSups, it was included in your contract as of last year, 10/1/2023. You had it, okay? I want you to know that this year, we're adding your PDPs to your contract. Tomorrow, it will be added automatically. There's nothing you have to do. So it will be added automatic. It's fully commissionable, and renewals will be paid. I hope you heard that. PDPs, fully commissionable, and renewals will be paid. As you know, there's several carriers that are not paying commissions on PDPs, and they're not paying renewals. That's not the case with Florida Blue. We're paying our PDPs and our renewals. And I almost forgot to mention, our MedSup commission, we're doubling to 50, which is also amazing. So commission for MedSup are doubling. And the last thing that I want you to know about MedSup, and this is an important thing to note, we're going to give guaranteed issue to any person out there that has Medicare and their plan is terming or their plan is exiting their county. So those two scenarios, if the plan is terming, exiting the county, we're giving guaranteed issue on the MedSup, which that's pretty amazing. It doesn't matter what carrier they have, as long as their plan is terming and exiting the county. Again, we're giving guaranteed issue. So that's pretty awesome. Moving along to the other update that I really wanted you to hear is the AOR policy change. I know this has been a pain point for all of you brokers. We heard loud and clear that, yes, we don't want to be working for free. So starting 1/1/25, so anything that you do for AEP and effective 1/1/25 on, plan changes will trigger an AOR change, and you will earn the renewal for that particular member going forward. So let me give you an example. We all know that Florida Blue has plenty of captive channels. I think most are captive. So let's say that you grab a member from a captive channel and you move them from the HMO to the PPO, for example. That will trigger an AOR change, and you will start getting renewals. Now let's do it the other way. Let's say that this captive broker grabbed your client, same scenario. They're moving from the HMO to the PPO. It does not trigger an AOR change for them, and they will not get compensated. This only works for you, FMO independent brokers, which is amazing, amazing. That's a testament of your work and the partnership that Florida Blue wants to have with you and how valuable you are to the company, because I can guarantee you this would have never happened. I was actually very surprised and happy that this happened for you. So again, this only benefit you, the FMO independent broker, If they try to do it the other way, try to take your member from the captive channel, they're not allowed, pretty much. So that's good news all around. So lastly, gas card program, so mileage reimbursement program will come back this season, and effective dates that are participating will be 11/1, 12/1, and 1/1. If you're new to the mileage reimbursement program, hopefully not, because we've done it for the last 3 years, but if you're new, all you have to do is submit your sales for 11/1, 12/1, and 1/1, and you will receive an email from me telling you, hey, you qualify for this program, sign this form, and once you sign the form, but basically we're going to give you $250 a pop, okay? So if you do 4 sales, that's $1,000 right there. Usually we give gas cards. This year, it's very likely they will do direct deposit because of the high amount. It's very hard for us to pay all this on credit cards, so it will probably be a direct deposit. So hopefully that's really good news for you. It's good incentives, and hopefully you will take care of it, take advantage of it for this AEP. So anything that I can do for you, answer questions, marketing, we still have time. I'm here to support, and thank you for your time.
Awesome. Awesome. So I've got a couple questions here. The first one in the chat here, Kent was asking about Baptist for Jacksonville. I guess there's something going on with Florida Blue and Baptist there in Jacksonville. Do you have any updates or clarification on that?
No updates. We have a website set up that I can provide to you. Let me see if I can post it here. That basically will give you updates on what's happening with the negotiations between Florida Blue and Baptist in Jacksonville.
Okay, awesome. You had mentioned about, if a plan is terminating or leaving the area, is that including, because that's for sub-guaranteed issue, is that just for subs or is that including Medicare Advantage that might be losing?
That's including Medicare Advantage. That's the big
Okay.
deal of it. That's including Medicare Advantage, yes.
Yeah, just want to clarify that because they could be on MA right now, but maybe they're considering a sub and you guys are going to take them that guaranteed issue no matter how long the line they've been on Medicare. So that's big
Correct.
news. Okay, awesome. And then the plan changes, that's incredible information. With the one-way plan change is fantastic. So they're in AEP, they meet one of the Florida Blue members out there, let's say it's in November, and they say, hey, I've got a better plan for you on Florida Blue. They write it for 1/1. Does that count as the plan change?
Correct. It does count as a plan change, so it will trigger AOR, and they will become the agent of record and start getting the renewal for that member.
Okay, so it has to be 1/1 effective or forward.
Correct. 1/1 on.
Got it. Awesome. Now, there was a rumor that we heard recently about the captive Florida Blue agents now going to be allowed to write other Medicare Advantage plans for the first time ever. Is that true? Is that a rumor, or do you have anything else on that specifically?
So it's not a rumor.
Okay.
Some captive agencies are being allowed just because of the disruption that's creating some of our exits, like, for example, the BSNP and the Valley PPO in some areas. So that's why Florida Blue decided to allow certain agencies. So I want to be clear, this is not open to all the captive channels, but there were few agencies that were impacted more than others because of the benefits changes. So Florida Blue decided to allow them to appoint in order to service these members and be able to move them to other carriers.
Okay. Got it. I mean, what I'm seeing here is Florida Blue, for the first time ever in its history, is really starting to be a bit more flexible. And that's good news for everybody. So thank you, Heidi, for making these changes. We really appreciate that. I know it was all you. And,
it was actually all of you too. Keep selling, and we'll eventually get what I know everybody wants under 65, and I get that question all the time. And just remember, where the market is moving, when the industry is moving, it's fully independent. So just bear with us, keep selling the Medicare side, and I'm confident that we'll get its ACA eventually. It's just a matter of time.
I love it. And then lastly, before we let you go, because I know you are super slammed preparing for AEP, if you could put your contact information in the chat for everybody, just in case they don't have it, Heidi. But the mileage reimbursement program is extraordinarily generous, guys. I mean, this is the company that's giving you $250 towards your gasoline for every application that you go out and do. I mean, I don't know. There's no one else doing that. So it's fantastic. And then just one ask, Heidi, if you can send over, when you get time, if you can send over that form, if it's been updated, just email me, and then I will post it in HQ for everybody so you guys can download it and fill it out and send it back to wherever it needs to go. We do want to make sure that you don't lose any dollars on, that mileage being reimbursement. I mean, just 2 applications gives you an additional $500 on top of your agent commissions and everything else you guys got going on. So fantastic. I really appreciate the generosity on that.
Of course, and part of the reason, FYI, because I almost forgot to mention this, part of the reason why it's so high, the gas card this time, is because we are sunsetting our HRA today. So we're not going to offer HRAs in our plans during the applications going forward. So since we're losing the HRA today, they figure, hey, why not beef up the gas card program? So.
Yeah, it makes sense, and thanks for mentioning that. So you will not see the HRA availability on HPM Shop or elsewhere, guys. So it's not an error. It's just not going to be available for 2025. So thanks for bringing that up. We appreciate that. But go get those gas cards. I mean, that's what it's all about. They're going to be tracking it automatically, but you do need to make sure that you have that form filled out. So we will post it in HQ to ensure that it's there in the updates. So we'll have several updates this week. Again, we're going to limit the amount of emails going out to you guys because we know you guys are getting slammed, you're busy, and you don't read them anyway. But if you can remember to go into HQ every once in a while, we will have all the updates that you should need right there at your fingertips and in an easy-to-read format as best as possible. So use the tools that you got, and we'll be here for you for AEP. So Heidi, thank you so much for being on the call this morning. We know you're super slammed. She put in her contact information in the chat, so make sure that you grab Heidi's info there. If you need it, if you missed it, if you need it, you can also email us at support@askhpm.com, and we'll be glad to connect you with Heidi at any point in time. So thanks again, Heidi. We really appreciate your time.
Thank you, guys, and have a great AEP.
Yes, yes. And with that, everyone, I hope you have a fantastic first week of pre-AEP from October 1st to October 14th. You can do everything except take the application. Okay, do not take any applications. They should burn your fingertips if you try to touch it. Okay, don't touch it. You can do everything else but that. I know that this will be a historic season for all of us, and we're just so proud to work together with you and serve you as agents. So everyone, good luck. We'll be here next Monday, and keep an eye on HQ. Have a fantastic week.